Okay, hello everybody. We're just going to start Eliza's presentation. Eliza is a traditional Chinese medicine practitioner, and this week she's going to talk to us about acupressure. So I'll just pass it over to Eliza. Over to you.
So yeah, thank you for spending the afternoon with me on Zoom today. So today we'll be covering mainly on acupressure points. And so without further ado, I'll start the first slide. So what we will cover today, there's a lot to be covered. So in the part one, I'm going to share the common diseases that we are seeing a lot in springtime in the clinic, and the theory of the 5 circuits and 6 Qis that we briefly talked about last time. We'll be talking about it again today. And part 2 will be the main session. Everybody wants to learn about the 10 useful acupressure points, especially in spring. So I'll be covering hay fever points, especially because a lot of patients have been starting to having sneezing or itchy eye sort of symptoms. And so these sort of points will help to relieve these sort of symptoms. Part 3 is acupuncture in Australia. So I will briefly share with you what's happening in Australia right now and what you can expect in a acupuncture clinic. And part 4 is Q&A session. I'll try and leave some time so that we can have an interactive session. So you can raise your hand or leave your question in the chat box. And I will answer to your questions. If we don't have enough time, we will also let you email the questions through so I can answer to your private questions, because I know this is a public space and some of your questions may be very private in nature and don't want to share with other people. So the next slide. So a little about me, if you haven't met me in person. I'm Eliza Chan, 40 years old. I'm registered Chinese practitioner in Australia, and I'm currently practicing in 2 locations, and I have overseas experience in Nanjing and Taipei. Before COVID, I was volunteering at the Bundana Alcohol and Drug Recovery Center, basically using acupuncture to help people to give up the addictions and help them to have a more calm sort of behavior. And I have some family influence in the medical field where my father is a Western doctor, dermatologist in Taipei. And my mother's side, my great-grandfather, he was the owner of a Chinese herbal dispensary. So I've got Western and Chinese medicine perspective in the family. So recently, my new goal is to share the knowledge and experiences in Chinese medicine on social media. So I've been putting on videos on YouTube and sharing blog posts on WeChat and like short stories on Instagram. My clinical focus at the moment is pain management and women's health, and I've helped a couple of women get pregnant this year. So some of them gone through IVF or they want to get pregnant naturally. So they will see me for this acupuncture treatment. And during COVID time, there's more people coming in for emotional support and insomnia. And recently it's more hay fever issues. You can have a read what other trainings I've done, because these slides will be available to you after this session. So you don't have to worry about jotting down notes. Just sit back and relax and have a cup of tea next to you. So the next slide, I'm just going to share with you some of the things I updated on my social media, and also show you what we've been doing in the clinic. So for this picture, you can see I've needle using the scalp acupuncture for this lady. She has really low energy. So she suffered from like chronic fatigue before, and now she's still having some cloudy mind issues. So these 4 points on the scalp is going to help her with her mind, so that she can have better energy and clarity when she thinks and keep her motivated. And the middle session is when we are out of lockdown. I've been seeing more clients coming in with weight loss or weight management treatment. So this lady has a bit of a, she wants to have a bit of a waistline. So we use acupuncture needles to thread around her waistline and use electroacupuncture to stimulate it for 30 or 40 minutes. And the top right is a acupuncture on the ear. So there's another system that we can do, because some people, they don't like acupuncture on the body, so they can also opt for this sort of acupuncture. So in the bottom right hand corner, this is a book club series that we did in Doncaster before, like way back before COVID, that we discussed a health related books. Usually it's TCM related books. So we spend about two hours going through the book together and sharing our own experiences, like how we self-care at home. So it was quite a successful event, and I hope that in the future, if we can't do it face-to-face, we can do it online. And then just to show you how to see my previous video on the herbal medicine seminar, you can go to my website, which is www.pinkstherapy.com. And on the right corner, you can click the YouTube, and then you can go into the YouTube channel. And the previous video is just here. You are able to access anytime you like. And the PDF is also available to you. You go into the description box, you will know how to get the PDF. You feel free to subscribe it so that you always get a notification when I upload a video. And then let's go to part 1. So the common diseases during July to September this year. So we go back to the wheel that we discussed in July, so that at the moment, we are currently in this session. So between 22nd of July and 23rd of September, we are in the Chinese medicine practitioner, we need to be more aware of wind heat. So like the hay fever and damp. So in Chinese character, if you are able to read Chinese, you're able to see this is a damp herb. So more damp heat, damp flame patterns you'll be seeing in the clinic. And because damp heat patterns are linked to our liver, gallbladder, so it's a time to focus on our liver and gallbladder. And so, for example, liver gallbladder symptoms can be people who are prone to the UTI or some other inflammatory diseases in the lower abdomen or lower extremities, or even acne that happens around the mouth. All these sort of things are damp heat related. Let's go to the next slide. Don't worry if you can't read the Chinese character. So it's just in a presentation that our Chinese medicine practitioner follow when we see our patients. So we had this slide last time as well, but just to recap that we are still having a lot of them in this period. So if you happen to have these symptoms and signs, so lethargic, itchy skin, foggy mind, joint or muscular pain, and if you poke your tongue out and you see a little bit of yellow tongue coating, or you have a dry mouth or bad breath, or these sort of things, it can indicate there's a more of a damp heat pattern you're having. So last month, we are focusing more on the damp cold, but now we are entering into more of a damp heat environment. So this slide is just for you to have a quick check to see whether you are more prone to damp heat or damp cold. So it can happen due to the diet we are having. So anything that's cooler than our body temperature, or too spicy or greasy, that makes our spleen and stomach a little bit hard to digest, so then will occur in those instances. Or if you are not doing much of exercise and sitting too much, you may also have dampness accumulating in the body. So just to continue what we've discussed before, because we are entering into a spring season, is associated with wind elements. And in Melbourne, it's already very windy, and the wind element is linked to our liver system, which is called gan. And liver also has a close relationship with our gallbladder in Chinese medicine. So from an ancient text, for simple questions, Su Wen, in this chapter, it says, liver is like an army general from whom the strategy is derived. So our gan system is in charge of all the energy movement in our body, and is in charge of the strategy that we think in our heads. And the liver blood is important to nourish our eyes and the sinews, like the tendons, so allowing physical exercises. And liver blood is also help for the uterus, so ensuring a healthy menstruation. And liver blood plays a role in our defense system against exterior pathogens. So say the pathogens from like the pollen or the external wind cold or even viruses, liver is very important in this sort of defense health system. And the smooth flow of the liver energy is essential to our mental health as well. So if the person is extremely stressed, their liver can be also damaged. And also when the stress is high, it can also affect our digestion and our capacity to make plans or have a sense of direction in life. So it's very important to keep our liver energy flowing during the springtime, because liver and gallbladder are also important for the courage. So these sort of things can deteriorate our liver or gallbladder system. So stress, or anger issues, or drinking too much alcohol, sleeping late, too much screen time, like using the eyes too much, and having a damp heat diet, so excessive greasy, spicy, sugary food can affect the liver and gallbladder. So we're going to the next slide, and I'll show you a Chinese medicine clock that we showed you last month as well, but our focus this time is the liver and gallbladder. So during 11 to 3 a.m., 11 p.m. to 3 a.m. in the morning, it's ideal that you are entering into a deep sleep so that your wood element is being nourished, so that the gallbladder is in charge of the detoxing in the body, cellular repairs that you can see on the slides, and it helps to build the blood cells. So you need to nourish your gallbladder by going to bed early, so ideally 10:30, so that you can be asleep around 11 to 3 o'clock. And liver, again, that we explained just on the previous slide, is very important. The liver blood is important in all sorts of things in our lives. So we really need to make sure we sleep early in springtime. So let's go into the most important part of today's seminar, acupressure points. So I'm just going to briefly talk about the tools that we can use to massage the points. So usually we can use our thumbs, our knuckles, and the elbows. And gua sha too, it varies. So in the clinic, we have tools like this, so that we can apply oil onto the patient's back or the acupressure points to do gua sha. or you can use also a porcelain spoon that you can find in the Chinese grocery store. And you will hold it like this, like so. And you will use this smooth side of the spoon to do the acupressure. Or if the point is, if the area is just a pinpoint, you can also use the handle side. And the massage oil we usually use in the clinic can include sunflower oil, H2O oil, sand gel, that's a herbal medicine gel, and woodlock oil and cream. So the cream that you might have at home, you can use is like a body cream or anything that helps to glide the gua sha tu or the massage motion so that you don't break your skin, because especially people who has very dry skin or elderly people or even babies, they are very fragile. So you really need to apply the massage oil or the cream to help the process. And something to help you learn the acupressure point is acupressure model that I've shown on the slide here. So in the human body, we have 12 meridians, like the lines going through our body from the toe to the head. Some are going from the tip of the finger to the shoulder. So depending on which meridian you're focusing at, you're able to look at the model and learn each of the point and the location. These are available for sale in Australia as well, or in China if you are if you know Chinese. But if you want to save money, it's easy nowadays because you can Google a lot of the acupressure points online, and you're able to see the location and video of the location as well as the indication. But these sort of things are really readily available now. So after this lesson, I hope I can empower you to self-learn these points and help your family. So other things you can do to self-learn is download the app on your phone. So 大家中文 is a Mandarin Chinese app that you can download that is free for you self-learn, and all the other thing you can have a check for yourself, but these have a cost attached to it, because these sort of apps are for usually practitioners or students of Chinese medicine. So you can also check my shop. If sometimes I upload like gua sha tu and also the massage oil on my shop. So if you are interested, you can also check it later. Okay. And before we introduce the commonly used point, we usually consider acupuncture first. There's an ancient saying, 一针二灸三用药. So when a patient coming in with a condition, we usually would consider acupuncture first, and then moxibustion, and then Chinese herbal medicine. And the WHO has already acknowledged 107 conditions. We can probably treat more than 107 conditions, but these are the evidence-based research that's been done to support that these conditions are treatable by acupressure. And dry needling is very different from acupuncture, because in TCM, we usually we treat the right side. So this is a concept that may be new to you, but I'm just telling you here so that you can be aware of it when you go to a Chinese acupuncturist. This sometimes happens like when you have a sore. Let me show you the next slide. So this person coming in with a sore arm, and however the Chinese practitioner will usually needle the opposite side of the person's thigh. So usually in Chinese medicine, the right would we use the left side to treat the right pain, and we use the below to treat the upper problem. So it's just some of the relationship that is really maybe difficult to comprehend, but just keep in mind that it's one of the things you can see what's what makes it different to a normal, like a dry needling session. So let's go to the first point, which is 迎香. This is located, like if you look at the screen, so when we look at the 法令纹, the nasolabial groove, so it's just at the level of the ulnar nasal. Ulnar nasal is just this area, and when you use your middle finger, you can, this is funny looking, but it works really well. You can do a circular motion going inwards, both sides, and do it 50 times morning and night. A lot of my patients do this before they have the hay fever symptoms. It helps to reduce sneezing. If you have a loss of smell or polyps or nasal congestion, it immediately clears the nasal. So in the morning, you can use a hot towel to wash your face and use a towel on your finger and to massage it. So this is located on the large intestine meridian. So that's why the English name of this point is called large intestine 20. So in English, the meridian and the acupressure points are numbered instead of having a name. So that it's probably easier for people to learn, I think. So large intestine, it will be called LI. So if you go on to Google, you're able to key in LI 20 acupressure or acupuncture, and then you will see the list of functions that it has. So this is very handy. So when you know the numbers, it's very handy to find the function of the point. Yeah, if you have any question, please ask me at the end. So because I have this 10 points or more I prepared for you today. And 攒足 is the second point we're discussing today. It's located in the depression on the medial end of the eyebrow. There's a supraorbital notch. You don't need to know the name like for these key words, but you just feel like there's a bony area and there's a depression. And when you use your middle finger or your gua sha tool, and you do a circular motion, you will feel very sore if you use your eyes a lot, or if you work from home and look at the screen a lot, this will be very sore. So this point is on the bladder meridian, and this is the second point on the bladder meridian. That's why it's called bladder 2. So bladder shorthand into BL, and this one is good for itchy eyes. So hay fever people, they just be aware this point is very important for you, and it's good for blurry vision and pain in the eye. Some people have pain around here or inside the eye or behind the eyes, and redness and swelling in the eye, and it can clear the wind heat and hiccups because it can regulate our diaphragm, and headache around here, and eye twitches. So I've also needled recently a Bell's palsy patient here because she's unable to move her eyebrow. It's a bit droopy. So I needled a few points along the eyebrow to help her gain that motion back. So with this, you can also use the similar way to massage it. Use 50 circular motion to 2 times daily. So after you wake up and before you sleep, you can, when you wash your face, you can do this. Okay, so next one. 外观 is on, so it's low, so it's Sunshell 5. It's a meridian on our upper arm. So if you show your wrist, and it's 3 fingers. If you like 3 fingers above your wrist crease. So it's between the radius and the ulna. So you can look at this one if you are into anatomical structure and you want to look exactly where it is. But if you just having But our fingers is really good that in Chinese medicine, the 2 inches can be measured using our 3 fingers because it's a relative thing. So using your own fingers to measure. So if you are massaging your kids, for example, you need to use their fingers to measure this point. So this is located on the hand Shaoyang Sanjiao meridian, and it can treat migraine, especially migraine on the temple, on the side of your head, tinnitus and laozhen, right neck, and numbness in the fingers or your hands and feet. You have hearing difficulty, you can use, if you have hearing difficulty in the left side, you can, we can needle the right point of this white guan. And this can also regulate our blood pressure and also thigh pain. If you remember the analogy that I talked to you about, the right treating left, top treating and if you want to increase bowel motion, this is something extra for you. You can Google Sanjiao 6, SJ6 to go, and you can locate it yourself if you are having trouble going to the toilet. Okay. Gong Chi is very important for hay fever and head symptoms as well because it helps to relieve wind. If you know Chinese, Gong is wind and Qi is a pool of wind. So gallbladder 20 is the 20th point on the gallbladder meridian. As you can see, it's sitting between these 2 bands of muscles. So this one, right on the left-hand side is our SCM muscle, which is behind our ear and goes to the clavicle. And at the back, there's a trapezius. So this one is just sitting below the occipital bone. And if you want to measure, you can measure 2 finger width from the midline of your head to, so it's on the side, on the both sides. So you can use your thumb and hold your head like this to reach this point and also massage using a circular motion. This one will help with the nasal congestion again, headache in this region at the back, stiff neck, hypertension, insomnia, and reduce eye pain, hearing loss, etc. It's a really versatile, the use is very versatile, so it's just not limited to one syndrome only. Because there are a lot of points in this area, so this is also a part very hard to find. So you need to really find the midpoint between these 2 bands of muscle. But as long as you feel a little bit sore, you can do circular motion. It's gonna help with the hay fever, especially because our focus is to help and relieve your current issues. And the next one that some of you may know if you are my patient, that I'm not sure if you already, is the long shoe point. It's on the bladder meridian. So that's why it's called BL, and the 13 points on the bladder meridian. So it's 1.5 turn from the midline at the level of the thoracic, the 3rd thoracic bone, which is here. And you can again use your finger as the ruler to find this point. And because at the back, I can show you how to do it, but usually you get help from your family members to help massage this point. And this is very good for respiratory symptoms like hay fever or coughs, asthma patient, nasal congestion again. Okay, asthma again, chest pain, breathing difficulty, or shortness of breath. So people who has lung diseases or who has a deficiency in the lung, this point will be helpful to them. So if the condition is cold, like they have really aversion, like afraid of cold, we use the heat, so it's called moxibustion. We use heat treatment over the point to help and warm up this lung point. And if the condition is heat related, we needle it to reduce the heat. But when we massage our pediatric patients, we massage the inner scalp. If you can see my cursor, you're going down from the picture, going down from here to here with oil will help them if they have a chronic cough. There's a lot of patients that told me that their kids are catching virus from childcare and they've been coughing a lot. So this exercise, this massage method will help them and clear that phlegm in the lung and help them to be able to breathe easier. Yeah, if you have question, you can let me know at the end. And another point that we use a lot for kids and also adults, this is probably the most common point you can see in Chinese medicine, is called He Gu. He Gu is a river valley direct translation, and it's sitting on the large intestine meridian. And if you look at your hand and if you do like this, it's easier to find. So this is between the first and second metatarsal bone and in the middle of it. When you use your thumb to press on it, it's very sore. You need to press so that it feels sore. This is a natural Panadol that we use in our clinic. It helps with inflammation in the body. If you have gum pain, toothache, sore throat, common cold, stomach ache, any pain in the body that is due to the liver energy stagnation that we talk about, you can use this point. Also, I use this point to help the Bell's palsy patient. Just one thing to know that in pregnant woman is better to avoid pressing this point unless you know what you're doing. So better not press this point when your family member is pregnant or yourself is pregnant. We only use this point to induce labor in some cases. And also, you can see in the diagram, we can also massage her for pediatric patients. And Tai Chong again, this one is related to the liver that we talked about, that we need to protect during the springtime, and is located on the liver meridian, and it is the third point on the liver meridian, which is between big toe and the second toe, just in the depression in here. So between the first metatarsal and the second one. This one, usually people feel very sensitive when they are in stress. And this one helps to improve our vision, relieve headache, the frontal headache or the side headache usually, and dizziness or vertigo due to liver wind, hypertension, insomnia, irregular menstruation, this is regularly being used, and deviation in the mouth or urine retention, etc. This is again a natural Panadol if you combine this point with the point we just discussed before, large intestine 4. It's a great pain relief combination if you use it together. Okay, I remember last there were people asking me in the questionnaire how to treat chilblains. So these patients have circulation issues that's why causing the discoloration of the toes and sometimes even pain. So this point is really good. It's called spleen 6. It's 三阴交. 三阴交 is 3 in intersection if we translate into English, because there are 3 meridians being intersected here on this point. So this point can definitely help a lot of conditions. It is behind the tibia bone on our inner leg, there's a tibia bone here, and you use 4 fingers spread above the highest point of the ankle. So it can treat gynae issues, digestive issues, menstrual cramps, helps the circulation in the lower extremities. It's also good for anti-aging, insomnia, skin allergy, a lot of things. So the spleen meridian is inside our legs, whereas the stomach meridian is on the outer part of our legs. Yes, just for your information. So we also have Feng Long. This point, yeah, please tell me if I'm too fast. Yeah, you can, you know. Feng Long is on the stomach meridian that I've just talked about. It's on the outside of the legs. The spleen meridian is inside our legs. So when you're trying to locate this point, it's in the midway between the outer ankle and the outer side of our knee. So it's the halfway. So we use this to find it, or some people, you can just make sure it's the same width. And you can, in the middle, this is stomach 40. If you have phlegm in your body, you will definitely feel sore when you press on this point. When you have phlegm dam in the body, you can use your gua sha tool or your spoon, anything, or knuckles to stimulate for 2 or 3 minutes, or longer if you have the time. Usually I ask patients to do foot soaking during the night. You can also do the leg acupressure when you are having your foot soaking. This point is good to reduce phlegm in the body. When we say phlegm in Chinese medicine, it's not just the phlegm that you see that you're coughing out from your lung, your throat. It's also invisible phlegm, such as a stuck sensation in the throat that you're not able to cough anything out, or any cyst or tumor in the body can be considered a long-term phlegm, because long-term phlegm would develop into tumor, cysts, fat around the belly, etc., etc. So if you want to lose weight, this one is also very good if you want to lose not just the weight that you can see on the tummy, also the internal fat that only shows when you do the body ratio, fat ratio, when you stand on a scale. So some people may look very thin, but at this point they may feel very sore. So this can explain that maybe you have a little bit of phlegm in the body. And if you want me to talk Western thinking, so this person may have a higher cholesterol reading, but may not be everyone, but this is very likely when this person feels sore in this point. And when the person is coughing with a lot of phlegm, of course, this point is going to help as well. And some people coming into the clinic with vertigo, and if the vertigo is caused by too much phlegm in the body, it can affect the circulation to the head, so which causing the vertigo or the phlegm misting the mind. So we can use this point to help. Also, if the patient has high blood pressure, you can also Google HT7, which is heart 7. We will cover it later if we have time, but I think we should have. Yeah, and yeah, you can combine these two and it will help to relieve and reduce the blood pressure. Yeah, we're just going straight into Shenmen. Shenmen, the heart 7, so save you time from Googling. So we just covered the Sanjiao 5, which was the 3 fingers up. Now we flip over to the inner side of the wrist. So it's at the ulnar. So ulnar is here and radius side is here. If you read the Google, you might not be understanding what's ulnar, what's radial side of the wrist, because the ulnar is sitting, the ulnar bone is outside. That's why it's called the ulnar side. So on the ulnar end of the wrist crease in the depression. So when you find there's a depression, there's a tendon here, is on the radial side of the tendon. So this tendon, as you can see from the diagram, is the pink band of muscle that goes up to the elbow. So it's here. So when you press on it, it might feel sore or it might not. So this is the source point of the heart. It can help to tonify the yin energy of the heart. So when a person has restless sleep, or they're not able to sleep at all, or keep waking up, etc., you can press this point. If it's really hard for you to find, you can also, because some people are very, the wrist is very small and it's really hard to, or the person is very chubby and it's hard to find the structure and the bone. You can just rub the wrist inside until you find it's warm and really, you can find a sore spot like this to help the heart energy. So this point again helps to calm the heart if the person is anxious or prone to worries, just cannot, a lot of racing thoughts when they sleep. So if you have palpitations or rapid heartbeat, anxiety, feel agitated easily, or having a tight chest, unable to breathe, or having insomnia, you can try this point to see if it helps you. So for the heart, 11 a.m. to 1 p.m. is the heart meridian time. So if you want to nourish your heart, it's good to have a small nap between this time. Because it's work from home for most of us. So like not me, but most of you. So you can find a time, maybe 5 minutes, longest 10 minutes, to sit and do your meditation and relax. Just close your eyes, and instead of looking at the screen, close your eyes and have a quiet time to yourself. It will nourish the heart and give you more energy in the afternoon. And if you have blood pressure, so we talked about in the previous slide, you can use this point in combination with the stomach 40. So it's not later on, it's before, sorry. So I moved the slides a bit, so it's not in the previous order. And this is I think we already covered a lot of points. I've given you 3 more points because I think a lot of people coming in with this sort of pain issues. So I want to share with you how to self-care if you have issues like back pain or shoulder pain. This is a really good point for that. This is called Shou San Li, large intestine 10. So that's why it's LI10. It's located when you near the elbow. So when you curve the elbow like this, it's sitting between the elbow and the wrist. So 2 turn below the crease in the elbow. So again, 2 turn is 3 fingers. So from the elbow, you can find 3 finger width, and you can find, I'm not sure you can see from the screen, 2 turn below the crease in the elbow. This point, you can use the anti-clockwise motion and massage it. It feels really, really sore when you're sitting in front of the computer, a lot crouching in the same position. So it's really good for shoulder and neck pain and uncomfortable sensation in the inner scap, so your upper back region. If you feel tight and painful, this one is good to release that. And sometimes good for tennis elbow or numbness in the upper extremities, upper back pain. And if you have trouble finding it, please let me know. I think it's very easy to find. All the points I have mentioned above is all very easy to find. And if you can't really find it, you just find somewhere that's along the large intestine meridian that is sore, and you can just go through these sore spots. And another way to check for diseases is you go through the meridian if you feel there's a bumpy road. So anything that feels tight and not smooth, you can massage it to help release any stagnation in the body. So anything associated with the neck. So I say knife cutting is a method that we use to help patients when they have issues. Is on the side, like on the side of your palm. This line is going to the neck. So if you have issue with the neck, you can use knife cutting, as in you can place your palm at the corner of your desk and just do this motion on the desk to help and relax your neck. While you're doing the knife cutting exercise, you can try to move your neck, and that will help to loosen up your neck, because a lot of time the position and the posture sitting in front of the computer is not really good for these muscles. So this sort of so on this line is the small intestine meridian. You can use this to help and relax the neck. Again, there are a lot of points that we can massage in the ear, but because today there's a limited time, we only talk briefly about this. But if you look at your ear, if you go around the outer rim of the ear and going through it, there are some points are very sore, and this is good for you can find this good point for the shoulder, the lower back. If there's any question, please let me know. But these are a lot of things you can do when you work from home, because no one is you won't feel embarrassed doing this when you are working at home. You can do this while you're in a meeting. I guess you are all massaging the points right now. And this point is called Tian Shu, which is on the stomach meridian. It's called stomach 25. We talk about this because we mentioned that damp heat is prevalent in this season. So a lot of my patients, if they have constipation or diarrhea, I will go for this point quite frequently. So it's located 2 turn again, 3 fingers width from your belly button, directly lateral to your belly button. It's on the stomach meridian, and it's a 25th point on the stomach meridian. And it can also help with vomiting, irregular menstruation, so either early or delayed. And also very important point for weight management that I showed you in the previous slides, that we use electrode connected to the needles to help movement in these areas. So massage tummy in a circular motion can help to reduce dampness in the body. So just showing you, you can use, if you have constipation, you can use clockwise motion. So from the swing, it goes from diarrhea, you can use anti-clockwise to help this. So you use the massage oil to do this, or another way is to vibrate the points. So instead of massage it like this, or you can use your hand to vibrate on the points to mimic the electro acupressure method that we did in the clinic. Okay, this is also the extra point that I'm sharing with you today. Is called Amian. So it's behind the ears. You can see in the diagram. This is an extra point, so it's not sitting on any meridian. It's an extra point located behind the menstrual process and sitting at the start of the SCM muscle that we talked about. This one helps you to relax and relieve headache in this region and any dizziness coming from the tightness of the neck. Sometimes the headache or dizziness is coming from this point is because this muscle is not relaxed, so making the blood circulation difficult to reach the head, causing the dizziness. So you can use your thumb and middle finger or tools to massage this area 100 times. Yeah, some of my patients tell me they massage 100 times and it's very helpful. But this is just a guide. You don't really have to follow like the numbers. As long as it works for you, like even a little bit, 1 minute. You can also use that to relax your SCL, which is the muscle from here to your ankle. Just use some oil to help them relax this. If you have trouble with your neck, sometimes this muscle is too tight. And for ladies, if you feel like your jawline is not very sharp and you want to reduce the water retention here, you can also massage this SCM muscle. Again, for better sleep, you can also Google kidney one, which is KI1 that I talk about here. You can use the moxa stick or massage. So moxa stick is something I use in the clinic, but sometimes I sell to patients because if you know how to use it, it's very helpful. So moxa stick look like this. This is a packed mugwort, dry mugwort into a stick. So you light one end up and use the heat hovering on top of the points to help relieve any tension or stagnation in that region. So yes, this is something that will help you to relax the mind because we use heat in kidney one to help drive all the heat down to from your head to pull the energy down to your legs so that you feel more relaxed. I hope you are so far so good. But don't worry, you can also go back to the slides or the video later to find the points. So this is something I posted on my Instagram. Sorry. I think 2 weeks ago. So because it's spring meridian and we talk about gallbladder issues that we see a lot, I've just added this slide so to show you what other things you can do. So you can put your legs up on the chair like this, and you can use your knuckles. So there's 4 points on the legs. So you can just go through this like this, or you can knock one point at a time, go down one. And usually people have gallbladder liver issues. This point will feel very sore. So you don't need to hit too hard to feel the effects. But make sure you're doing it from top down, unless you have low blood pressure. So if you have low blood pressure, you can go bottom up. That won't affect you too much. But this will help to help you to have smooth flow in your gallbladder meridian, help you to really release any wind in the body. So to help skin rashes, help you to relax your mind, helps with tinnitus or hearing loss that's due to the gallbladder issues. Yes, so this is something you can try. So sometimes I update in the story something like this to help my patients to self-care. Let's see. So more self-care homework that I usually give to my patients is something like this, but not everyone will get all these, but these are sort of things I will give to a patient in these 2 months. So if the person is very negative or they feel a little bit demotivated, I will ask them to write down 3 things they are grateful for every day. So either if you are a morning person, you can start with this exercise first thing in the morning before you have that sip of warm water. And the second one is exercise at least 30 minutes 3 times a week, so that you are having the better qi movement in your body. And also it's important to have enough sun exposure because the research has shown that a lot of the COVID confirmed cases, if they have enough vitamin D in their body, they're unlikely to develop into an ICU case. So it's I've been telling a lot of my patients who are deficient in vitamin D to make sure they have enough sun exposure and take vitamin D if required. Food soaking in hot water is again good for kidney and good for these insomnia patients. If they have a lot in their minds, I always ask them to have a little bit of food soaking every night so that they can easier falling asleep. Of course, if your symptoms is severe, I would suggest you to see your local practitioner to get some help from either herbs or acupuncture. And of course, if you are not severe, you can try this food soaking as well as the points that I mentioned before to help you sleep better. And the fourth one is spend 10 minutes praying or meditation every day that we mentioned before during the heart meridian time, 11 to 1 in the afternoon time. You can schedule 10 minutes for yourself, block that time out so that you have that time for yourself, praying to God or meditate, closing your eyes every day. And the fifth is learning something new. That is what you are doing at the moment. Learning with CAF, for example. So that keeps your mind away from like the COVID or the bad news, so that you feel like you are always on the proof, and you feel empowered that you can do something for your health, which is really important in this time and the age. And 6 is sleep before 10:30 that we talk about. Between 11 to 1 is a good time for detoxing the gallbladder and liver. And having more green leafy vegetables, again, is good for our health. And avoid cold raw or greasy spicy food. I think I mentioned too much. We can go to the next one. Sorry that we are going over time. If you need to go away, it's okay, because we will put the slides up later. And sorry for the host that have to.
No problem. We are loving it.
I don't know. Sometimes I talk too fast. Sometimes I don't want to talk too fast when I teach the acupressure points. So these are the great herbs for hair at the moment. Just want to share with you, like, these are really good herbs too. If you have initial symptoms, the middle one is really good to calm the symptoms down. And the left one, if the symptom is more severe, and the right one is you haven't developed hay fever, but you just want to prevent it. So these formulas are available at the clinic in both Doncaster and Clayton, but you can also shop online if you want. Part 3 is the acupuncture in Australia. So what to expect during your initial acupuncture treatment? If you are my patient, you know that we asked a lot of questions in the first session. There's 2-pager questionnaires that you need to write down, and we go through the question together, and I look at your tongue, your facial feature, and your symptoms and your pulse to work out a treatment plan for you. So that's consistent in the consultation, and then we use the needle to help you to treat your issues. And sometimes we combine with moxibustion or cupping or gua sha. And then at the end of the treatment, we will tell you the homework that we discussed before. Like some people will have extra homework, some people have less, depending their lifestyles and the severity of the symptoms. And the treatments can be claimed under private insurances. So at the moment, acupuncturists are considered allied health for most of these companies. For some of the companies, I don't have the logo for. So if you are not sure, just call your insurance company to check. Usually, if you are insured, you can claim some of it back from extra. And this is something I want to share with you. This is a little bit sad thing that's happening in Australia, is because at the moment, any GPs or medical practitioners can provide acupuncture, but usually it's more like a dry needling under the current Medicare benefit scheme. With most of our people in our profession will say this is unfair because our qualifications is definitely higher than in GPs, because from what I heard, some of the GPs only attended a weekend workshop and they have the certificate and they claim they are able to perform acupuncture, but it's a totally different style. It's more like a dry needling. They do needling on the muscular, the side where you have the pain, which is a part of acupuncture, but not the total of it. So I did a bit of research to show you the figures as well. So from the 19 to 20 report, Medicare has reimbursed 19.6 million to Australian GPs performing acupuncture to patients. Although this is a small part of the reimbursement, but we still think if our patient can get access to Medicare benefits, they will be able to get more help from us when they need. So our professional bodies have tried and applied to be included at least in the CDM plan. This plan is called Chronic Disease Management Plan. This one is available if you have chronic pain or chronic diseases. So you can discuss with your GP and you are eligible to get at least 5 free services throughout the year. But I heard this year for some GP, they are allowed to give patients up to 10 free services, especially for the mental health. So these allied health includes podiatrists, physiotherapists, psychologists, dietitian, etc. But so it's again unfair that although we are also allied health professional, we are not listed under this management plan, because the paradox thing is the CDM has to be referred by a GP to be able to see us. As GP is already providing acupuncture services to the patient, so the Department of Health has responded to our application and said that there is no need to provide further benefits to our patient because the GP can provide acupuncture. So we are continuing to work on this part to help our patients to be able to see us more frequently, or for the broader community to know what the real acupuncture is, because some of our patients may get a bad experience from a GP or someone else that's doing dry needling, and this is not good for people to know acupuncture from another profession. So we will want to see some change in the future. Yeah, we will go to the next slide. I'm just going to share with you because we are currently in a more stricter lockdown. So unfortunately, some of the patients that my clinic may have turned away this week because we are only able to see, we can only see urgent care patients. So this is the list of things that are considered urgent by the Department of Health. So for example, at the moment, I'm still able to go into a clinic and prescribe herbs and see patient online. And I can also see face-to-face patients if they are in like excruciating pain or or they are having pain and they don't see me, their vision will deteriorate, or they're preparing for fertility or IVF pregnancy. And a few patients coming in with skin issues that's really uncontrollable, and Bell's palsy, and patient who have been to ED for their condition. So I'm treating for the sort of like emergency cases or mental health patients. So this sort of give you an idea what sort of thing I can see. But if you're unsure, please feel free to contact me, and yeah, I can see on a case-by-case basis.
Okay, so all that remains now is for us to thank Eliza. I put her feedback link on the webpage of her presentation. So if you've forgotten what it is, you can always go back to her presentation page and the link will be there. So thank you very much, Eliza, and thank you, everyone. Bye-bye.
Thank you, everyone, for your time. Thank you,
Thank
Nicholas.
you.
And
Thank you, Eliza.
for turning on your video. I will have a final bye to you all because I couldn't see you while I'm having the seminar. So thank you, Vivian. Thank you, Maureen. Thank you, Bruce. Thank you, Nicholas.
Very informative.
Thank you,
Very well.
Ben.
Thank you.
Thank you, Leslie. Thank you.
Thank you, Ellen.
Yeah.
It was a very interesting talk.
Have a good weekend. Hopefully we will go out of lockdown soon. Good to see you online.
Thank you.
Thank you, Lisa.
Okay.
Thank you.
Bye-bye.
Thanks, bye-bye.
Bye.